Hey, everyone. It's Dr. Tamara Beckford with Your Caring Docs. That's right, where we help our busy professional women put their health and wellness first for at least 2 hours a month. Why? Because there are 730 hours in the month we can dedicate to ourselves. Okay, that's right. Now, our Your Caring Docs Who Cares podcast, we have doctors from all over the world. We have the top docs stopping by here and dropping their health and wellness info, aka gems. That's right. Best part is they're going to leave their info so you can get in contact with them if you'd like to be a patient or a client of theirs. Today, we got one of the top docs, but I have to bring her in Your Caring Docs fashion, right? So this doc today is not only a super doc, and she's one of my friends. And like I said, I'm going to share her with you because I am so generous. That's right. So this doc is a graduate from the University of Lagos and College of Medicine. Then she did her residency in internal medicine at the University of Pittsburgh Medical Center Mercy Hospital. But my doc did not stop there, right? So she went ahead and she did a fellowship in rheumatology at the University of Washington. Now, this doc is currently a managing partner of the Overlake Arthritis and Osteoporosis Center in Bellevue, Washington. She is creating the Center of Excellence in Rheumatology in Washington. This is our doctor who's been a top doc for multiple years in arthritis today. She has multiple accolades, and I am here to bring her to you. So we have the one and only Dr. Arinola Dada.
Thank you so much, Dr. Beckford. I appreciate the opportunity to be on your show. I love watching your show. I learn every time I listen, I learn something. So every time I listen, I learn something. Right. So I'm just, I was actually listening throughout yesterday. I was like, I want to kind of get a vibe for Dr. So I kind of went back to the old shows and I was like, your show is a must listen to. So thank you so much for having me.
Thank you. So you guys heard that. You heard this from the top doc, and I didn't pay her. She's just
she didn't.
Yeah, Dr. Dada, I'm telling you, one of the things I love about Dr. Dada is that she is not only a top rheumatologist that's out there that's providing excellent care for her patients. When we met Dr. Dada, she says, I have a really great office and I'm doing well, but I want to be able to help more people. And how does she say I'm going to do that? She says, you know what? I am building the Center of Excellence, not a wonderful building for others to stop by. No, she's building the Center of Excellence for rheumatology. So all our people up in the Washington area, in the Bellevue area, you have like your top doc right here. So right now, I'm going to dig in and find out a bit more about her so you can get to understand why I love this lady so much. All right. So Dr. Dada, tell us, what brought you into medicine? Where did this love and this passion for medicine come from?
So, thank you again. So I think I believe sometimes it's just better to be lucky than good, right?
Right.
So I was lucky enough to be born to a physician. So my mom was a doctor. And I have two parts to that. So one is just I was privileged to have been in an environment where you kind of see the whole picture of what it is to be a healer. So whether it is the responsibility and the dedication or the rewards on the other side with the joy. I think as a kid, I would see people who my mom had treated, her patients, and it was always just love for her. So to be honest, it was really more of just seeing just that love and admiration that people had for her that I just said, I want to be like, exactly. So that honestly is kind of goes to the core of how I even got into medicine. It was just kind of seeing, so I was too young to really know what it meant to be a doctor. It was just like, all these people just said, your mom helped me so much. So, and they would kind of, I was brought up, I was in Nigeria. So it was more like, people would pray for you and say, you're Dr. Talabi's daughter. And everywhere, every time I met anyone, it was always just love and appreciation and admiration for us. So I kind of put my hand up and say, hey, I want to be part of that. And as I got older, it became, so I'd always wanted to be a doctor. I've never really thought about being anything else. So I think that's kind of where that came from. And then over time, it became kind of more of a mature and more kind of thoughtful into, this became my calling and my passion. And every day I go to work, I love my patients. I think I'm so blessed to have picked this specialty. And I forget, the time goes. It's like, wow, it's 1 o'clock when that happened. It's 5 o'clock when that happened, right? So I think that is kind of how I was lucky enough to kind of see the back end of medicine from the provider standpoint and the physician standpoint, and really just kind of get that, love for medicine just more as I grew up. So I think I was, like I said, lucky.
Oh, wonderful, wonderful. So you went through a different phases, right? So it's, hey, mommy's a doctor. Everyone loves mommy, and then, but you still have to work for it, right? So one is just like, woo, okay. So this is not as just like, okay, I want to be a doctor. I am having to grind, as we said. You're putting in a lot of work. And then you did medicine. And then you're like, rheumatology. I want to do additional training to help more people in rheumatology. Where did that passion for rheumatology come from?
So again, it's luck.
I love
but
it.
Sometimes
I'm going to stay next to Dr. Dada, because Dr. Dada is one lucky woman. So I need some of her luck to keep rubbing off on me. Go ahead.
So I got into an internal medicine residency program in Pittsburgh, and I think, and there I was again lucky enough to have done a rotation pretty early, like my first few months, with these two rheumatologists who were just genius.
Wow.
They were genius. They were passionate about their work. Patients loved them. They never seemed to have a bad day. And I just kind of said, and I think the most important thing was just the fact that they could make a difference in the patients' lives, right? So that was when some new treatments were coming out. And I would say some of those new treatments, I tell my patients, they're like, it kind of sounds scary talking about medications like biologics. But I tell my patients, I said, even medicine has benefited from the improvement in technology. Absolutely. So in rheumatology, a lot of complex conditions, but the treatment that they had back 40 years ago is my best analogy is that you're comparing kind of, the phone booth on the freeway. Yeah. That you may have seen in movies, most of you, those phone booths and how you can compare that to this cell phone that you can take pictures and send messages and emailing. That technology has also progressed in rheumatology and in medicine. Yes. So now we have the benefits of technology in medicine. And so one of the things that really drew me to that, other than I kind of really loved the attendings, and the patients appreciated them, and there was this back and forth. It was like a love fest, was just the fact that you could actually make a difference, right? Absolutely. And so I think over the years, when I would talk to some of my orthopedic colleagues and they say, hey, Arinola, you don't send me patients with rheumatoid arthritis for surgery anymore. I was like, it's nothing personal. We just have better treatment options. So those joints don't get damaged anymore, right? Right. So I kind of was, again, lucky enough to have got into medicine just when all this was transpiring into rheumatology, about 25 years ago when all this was transpiring. And so that just kind of was kind of the final light that, wow, this is a dynamic, interesting, specialty, and you can really make an impact on the lives of patients. So I think that's kind of what kind of my full circle from putting my hands up to saying, hey, I want to be just like my mom, just like my attendings, to finding this niche of, where I could really make an impact on people's lives, and we can change the course of how the autoimmune disease can attack people. So
wonderful, wonderful. And you are making an excellent impact on these people's lives, because you are a 5-star review doc. And when I say she's a 5-star review doc, I'm not saying she got 5 stars from 2 patients. No, this is like almost 100 patients, and they're all leaving 5 stars. So that she is that good. And I want you to know that you're having that much of an impact on these patients' lives. Alrighty, so I want to pull it back to one of the common, a very common rheumatological issue that is out there, which is gout. A lot of people, I see them as an ER doctor. I look through the meds and I'm like, uh-oh, there goes that med. You have gout, right? So for those who are listening, let's explain to them what is gout. And then we'll dig a little further to help those who might have gout out. We'll help them out with a little bit of more info. So we'll start out. What is gout?
Gout is a condition where your body is making too much uric acid and it ends up in joints. If we think back, anybody who loves history, I think everybody likes Henry VIII's story just because the guy was crazy, but he had gout. He had gout. Henry VIII had gout, and so they describe gout as, a sensation that someone came while you were sleeping and smashed your foot with a hammer.
Yes.
And so the pain is that intense. It's 10 out of 10 or 12, 12 out of 10, and it gets better. And a week, 2 weeks, a month later, the person comes up with another hammer and smashes your foot. Oh. That is the experience of that. So it's painful, it's swollen, it's inflamed because your body is making too much uric acid and it can't get it out through the kidneys. And people say, hey, does that mean my kidneys are not working well? No, actually, it's almost like it's a special talent of the kidneys. So assuming, I think my best analogy is everybody's kidneys, if they're normal, should be able to kind of go for a stroll. This has to be able to jump hoops. So genetically, you're predisposed to having gout if your kidneys can't jump hoops. They can do the normal function, but the special function requires that ability to jump hoops. So being able to excrete that uric acid is what determines whether or not you're prone to gout. So uric acid comes from the body. Your body makes uric acid because it's a breakdown product of protein. There's foods that you can eat that can make it more likely that you'll get gout. So high fructose corn syrup, soft drinks that we shouldn't be drinking is one of them. Yes. Yeah. Okay. Yeah. So
let's say that louder for those in the back. I don't think that a lot of people recognize that.
Yeah, people don't think about. That's why I wanted to talk about that. Is high fructose corn syrup drinks, those the soft drinks. Yeah, so those things predispose you to gout. So does beer, right? So does beer, because you can do without those things, right? Shellfish, I love shellfish. So, but I think in moderation of that. But if you can do without the beer, you can do without basically those things that are really packed with protein, right? Keeping well hydrated, vitamin C, those things all help to kind of lower your uric acid and help your body get rid of it. Now, men are more likely to get gout than women before menopause because the estrogen that we have before menopause allows us to excrete uric acid.
Oh, so it's protective.
It is. And every month we have those menstrual periods that we're like, what the heck? It does one thing for us. It gets rid of extra uric acid. What? Yeah. So, it was worth something. Yeah. Once we hit menopause,
oh man, there we go. Things have paused.
And so then our risks have to rise to the same level as men does. So
are you serious?
It starts to rise. Yeah, it starts to rise. It's not overnight, but it does start to rise. So in our more mature women is what we call ourselves.
Right,
now.
Exactly.
Yes, in our more mature women. Dr. Bedford's pretty young. In our more mature women.
I'm entering the wisdomhood section of life.
So, my more mature women, when they start complaining, when they have that, someone smashed my foot with a hammer kind of complaints, then gout is one of those things we do think about.
Wow. So I love the fact that, most of the time people, when they think about foods that they have to abstain from, we're always saying everything with pyridines and they're like, well, what have pyridines? Sardines. And well, I'm pretty sure a lot of people are not eating sardines right now. Now, in my family, yes, we do eat sardines every once in a while, but high fructose corn syrup is in so many of the foods that's out there. And to know that this very commonly used substance is increasing your risk of your gout flare I think that that's something that everybody should know. So that's why I'm re-emphasizing. So when you're looking at and if you think it is in the bread, and so you'll see in ketchup. I mean, something as simple as the ketchup, right? So you'll see the different ones that are out there. So when you're going grocery shopping, if you're listening to this and you're prone to gout, start turning around those food and looking at the labels. And the high fructose corn syrup is usually number 1 or number 2 on that list of food.
Yeah. So, I think, really just being more aware.
Absolutely.
Is kind of the first battle, right? Being aware, being knowledgeable, and then you can kind of decide, right? If you understand that, hey, if the beer is going to cause my gout to be aggravated, then, maybe I want to minimize my intake of that, right? Versus just kind of going out in the world and saying, well, I don't know what happened, why I got my gout attack. At least, and this is where you're informed, right? Absolutely. So I think just being informed, then you can because I think we can all make decisions when we have the information, right?
Yes, and you make better, and then and you'll talk with your doctor. So if you have an event, right, you're celebrating something, because I think that what we're trying to really highlight is not to say that, okay, well, we don't want you to ever celebrate. We don't want you to ever have fun. You have a momentous occasion that's happening within your family and you like to celebrate. Talk to your doctor, have an idea of what quantity and what you might be able to tolerate in order to not have that gouty flare, So that's what their specialists like Dr. Dada, that's what she's here for. That's why she has this center of excellence. It's not just there to be a nice, pretty, she is dropping knowledge. And like I said, a lot of people understand what's going on. So we're reducing flares from, 1, dietary restrictions. Or is there anything else that those who might have gout need to think about in order to reduce their gouty flare attacks?
So hydration is really important, right? So just anything that allows you to kind of increase the excretion of gout. So hydration is important. There's some studies that show that vitamin C supplementation is important, right? And then I think be really getting in touch with your doctor, because I would say of all the conditions I treat, the gout is the easiest to treat and to prevent the attacks. So all the conditions is the most satisfying thing to handle. It can just be taken care of and you don't have to go through those multiple episodes and attacks. So that is one of those things that it's very easy to treat and there's no reason to suffer.
Alrighty. So now I know most patients who have gout, they're usually on some medications. So let's go over so that you understand why you're taking this med. Not that we're sitting there trying to not have you have fun. We're really trying to prevent those gouty attacks.
Yeah, so medications that I use to treat gout. So I tell, I like to break it down into 2 major forms. So there's medications that I use when, then the hammer has just been smashed on your toe, right?
Oh, yes.
But during that acute, painful, I can't put my sock on. Nobody should even come near my toe. It's so sensitive to touch. During that time, there are medications that calm down the inflammation. So I do explain to my patients that, hey, the reason why you have gout is not so much that you have those crystals in your joints. It's just that the crystals moved. So if you are actually being very good, and you're keeping well hydrated, you're staying away from all those foods that are more likely to aggravate your attack, and your body's uric acid level starts to go down, the uric acid in your joint starts to move because it kind of wants to move out of your joint. But you're like, great, that's what I want. But anytime things move in and out of your joint, so if the uric acid moves out because you've been good and it's trying to get out the joint, great. Or if you just had this, party, you had some beer and some shellfish, had a little, a caffeinated beverage too, and then you got a gout attack. You get a gout attack because your uric acid levels went up and then they move into your joint. So anytime uric acid moves into the joint or out of the joint, your white blood cells, those are your soldiers, they're like, what's that?
Yes, there's a movement.
Something's happening. There's something that doesn't belong there is there. So your white blood cells come in, and they are what? And the influx of white blood cells is what causes that acute attack. So the way we treat it then is twofold. One is, how do we calm down the pain and the swelling? So the reason you go to your doctor, the reason you say, what medicine can I take? That's the acute inflammation. So how do we get rid of all those white cells? So we can use things like steroids. We can use a medication called colchicine. We can even use things like ibuprofen. But you kind of have to talk to your doctor, because some of those side effects, you kind of just have to be careful with. Right?
Absolutely.
So a lot of people self-treat themselves with ibuprofen. Unfortunately, some people have done it to the point where the ibuprofen has caused them kidney problems.
Right. And that's why it's so important to work with your doctor.
That is why it's so important. So I have actually had patients that were referred to me from the kidney specialist saying, hey, this guy took so much ibuprofen that he killed his kidneys, but now he has kidney problems and gout.
Yes.
Right. So those are the ways to treat the acute attacks. So we said steroids, medication called colchicine, medication called, ibuprofen family, right? But again, talk to your doctor. So that's treating your acute problem. And then the more chronic problem is, well, your body is making so much uric acid. How do we stop it?
Absolutely.
So stopping it includes, there's certain medications called allopurinol and Uloric. And what they do is, when urine is being broken down in your body, it's a process, and there are multiple steps. And the uric acid is just that crystal, and there are multiple soluble forms before you get to the crystal. So it kind of just holds the door and prevents that final uric acid formation. So those are the medications that we use more long-term to prevent acute attacks. So that is why I feel that it's very satisfying to treat, because once you get rid of the gout crystals in the joint and you don't make any more, you're home free.
Woohoo! And the pain and the suffering is gone. And you can understand, not only are you excited, but think about it. Our doctors are excited too, because we're like, yes, you're no longer in pain. And it's so satisfying for us. So, that's so important that for those who do suffer from gout, if you're predisposed to it, like you said, if there's, it's in the family, because maybe your kidney just can't do that hoop dance like everybody else's kidney. It's functioning, but it can't do the hoop. And then what? You're increasing your risk of the buildup of the uric acid, therefore increasing your risk of having that gouty flare, that hammer, bam, that wake you up in the middle of the night and you haven't done anything, right? That pain, that discomfort. So self-care is so important for you who are going through gout. If you know that you're predisposed to it, if you have gout, you're taking your medications to prevent that buildup of the uric acid. One, you're keeping your diet in check, talking with your doctor, whenever you're getting ready for a celebration, trying to ensure that you can go out and, celebrate with your family and friends, but you're doing so in moderation, right? To reduce those flare-ups. So you're taking care of yourself. We're so happy. But now we need to know this from Dr. Dada. What are you, Dr. Dada, doing for self-care? Because we're taking care of all these patients, but what are you doing to take care of yourself?
I think self-care for me has, it's always a work in progress, right? It's always an evolution, right? I think the things that I've needed in my 20s, in my 30s, in my 40s, and now hoping to get into the 50s are different, and they evolve, And so I think from my early 20s, I think I really got into exercise. And over the years, the reason for those exercises changed. It's gone from, I needed when I'm in my 20s just to kind of deal with the stress of medical school. So although I put my hand up that I wanted to be a doctor like my mom, man, that was hard.
Exactly. That's what I was saying. Don't think that, I want to be a doctor, and it came just like that.
That was the easy part. That was very, very hard for me. And I think when I was in my 20s, I'll have a little confession time. I think I ate a lot of my feelings in medical school. I remember, having my milk and my oatmeal cookies. I still remember that. And my head falling down into this Grey's Anatomy book that I was trying to commit to memory, and it wasn't happening by passive diffusion.
No. You're like, maybe there's so many ways that as a medical student, you're like, how can I bring this info in? And everyone has that. If I put my head on the book, maybe through osmosis, I'll gather this info. And for some reason, it never works.
Never worked. So, so I think I developed to kind of got into exercise, because I was really not a high school athlete at all. And so I kind of got into exercise in med school, basically as a way, one, to be healthier. And then over the years, I think it became something that I did. So initially I would just go for walks, because my time wasn't that, nobody else really needed my time. And so I think in my 20s, up to kind of just before having kids, I used to just go for long walks. That was my thing. I called it trekking. I'd go for long treks. I could go for an hour, 2, 3, didn't matter. That was kind of my thing. I have my music, I'd be jamming, and that was my thing. And then I think once I had kids, then there was more of a demand on my time, and I couldn't be going away for 3 hours. And so it became where I said, no, you couldn't, right? So
you can't even go use the bathroom at times.
I needed to start being a little more efficient. So I kind of started to do little 5Ks. I tried to do longer, but my body's really not built to be a runner. And then over time, I kind of evolved and started going to the gym. I got a trainer, and then I started kind of doing things myself. All the way into, pandemic, went back to work. So I kind of always evolved to when now I ride a bicycle, right? So, but I think that exercise for me, one, I think it just kind of helps to calm me. So at this phase of my life, it's kind of more calming for me. And so I get up in the morning and I say, wow, I have a busy day. Let me go work out so I can have the energy for my day. So that's kind of why I'm like, oh, wow, I think, oh my goodness, I have this busy day. Let me go work out in the morning so I can have the energy and just kind of the peace of mind to kind of take on what's coming. So I think, so over the years, even the reason for my exercise has changed. But the other things in terms of self-care that I kind of, I've started to pay more attention to is even just kind of the spirituality, right? A little bit more of mindfulness. So for instance, one of the things I've kind of come across and listening to, I think one of the guests that you had in the past, talking about, just a little bit more of the mindfulness and meditation. But also, I think I've also come, my inner voice, for instance, right? And that's something that I'll tell you just right now, I'm working on it.
Yes.
Because that inner voice has been with me for the last 49 years. And really, it's my constant companion. I found out recently, and it's not the nicest.
No, sometimes that inner voice, and it might end up being the first statement of the day also might end up being not a very nice statement. It's not giving you positive vibes. So
I think that in terms of my self-care is something that is just a work in progress. That inner voice is 49 years old. And so trying to change it and, so that's kind of what I'm working on, because I think that I could be nicer to myself. Sometimes I think, would I actually say that what my inner voice just told me, would I actually say that to somebody? And I would never say that.
Absolutely. Absolutely. I love that you mentioned that, because that's something that I myself even am working on, right? And I started, it's a work in progress, and it's not easy. So there are two things that you just mentioned. One, our inner voice that states a lot of negative terms. And the first step is recognizing it, because our brain, we know our brain can't tell the difference. They hear this inner voice and then they think that it is a receptive information, but it's really just us bringing it to ourselves, right? So if you can, one, find out, okay, when it's happening, to stop the thoughts, which is one thing that I've been working on, when that negative thought, being aware, like, wait a minute, I just said something negatively to myself, stop it. And then try to bring around, like you said, the awareness, like, I would not say this thought to someone else if I were to use this phrase. So I'm not going to use it to myself. And just keep being aware until I can change just a little bit at a time. Because as you said, this has been over 40 years of these thoughts. or this particular habit. And so we know it's not going to change overnight, but being aware of it, is the first process. And then that being at one with yourself and peaceness and stillness, that is so hard. You see that on that episode that we had with Dr. Rashmi, where we're doing the meditation. I think we did a 5-minute meditation. By the first 30 seconds, my brain went X. And, but one of the statements that she made, she said that it's simple, but it's not easy. Yeah. And therefore it takes work. And I'm still working at it. I think I probably made it to maybe 5 seconds now without my brain just automatically going and thinking about, gee, what am I going to do after this? Oh, I have to do this. I have to do that.
It's so true. It's so hard. I've been trying to do 1 minute. Yeah. And
even just 1 minute is hard. So
I'm trying to do 1 minute, but you know what? Every day I try, I'm getting better and better, right?
Absolutely. Yes. And that's how it is. Every day there's an improvement. It's a small improvement until you look back and you realize, wow, I can do a minute
of
mindfulness. Absolutely. Absolutely. Wonderful. Wonderful. All righty. So now we're finding out about self-care, and we found out that both of us, our minds race like crazy, but we're working on our stillness and our mindfulness one day at a time. All right. So Dr. Arinola Dada, if you weren't a doctor, now you got to sit and figure this out, because you wanted to be a doctor ever since. But if you weren't a doctor, what would you be?
I think I like to help and motivate people. Mm-hmm. Sometimes my techniques don't necessarily work because I'm not a professional. So sometimes I have people that are I have people that, over the years that I've mentored, mm-hmm. and some I just kind of totally carry with me, and some I think just my energy and my vibe is really not meshing with theirs. And I think that if I had any other career, it would be where I am encouraging and mentoring, and hopefully I would have gotten the skill set to be able to apply my passion to many more people. So mm-hmm. I think either way I'd be in maybe a high school, college counselor type of person, or a coach motivator in some, if I had just everything to start again, in some way. I think I really love to kind of encourage people. So in my clinic, it shows up as me encouraging you to try XYZ so mm-hmm. that we can get to, the goal of making sure that you have just those healthy joints and we've been able to preserve them. So absolutely. I think that's, but thank you for that question. I was really kind of thinking about it, and I was like, I've always just wanted to be a doctor, but I think that would be that's the other thing that wakes me up is I love the idea of educating children. Mm-hmm. And that's one of my side gig passion things that I, started doing on the side. It would be something. I don't even know that it's a side gig. I guess it's just something that I do on the side. But I think any of my friends who have kids, they know me as Auntie SAT. SAT Auntie. Just motivating and just spreading the love and joy throughout. The ultimate motivator. That's who you are. Motivational speaker, counselor, extraordinaire coach, just having everybody up, moving. And then but the thing that I love about this question is that a lot of my docs, when I ask them this question, a lot of the things that they're saying that, if I were a doctor, I'd be doing that. And I'm like, interested, because that's exactly what you're doing now, in addition to all of that. So you are motivating, you're getting people up, you're having them have healthy joints. They're able to live very successful and joyful life with their kids, their grandkids, they're mobile. They're no longer looking at life from the outside, looking through the window. They are out there with the family. They're moving around. They're doing selfies. Look at me. And this is all because of you, Dr. Dada. You are out there and you're not just saying it and motivating, you're having them do it. Now, let
I'm pretty sure those who are listening, I'm pretty sure there are a lot of people here that's like, okay, I need to know who this doctor is. Where is she? Where can I find her? Because I want to be part of that Center of Excellence in Rheumatology there in Bellevue, Washington. Let us know, where can we find you?
Well, thank you. Thank you for the accolades. But I am, we are at Overlake Arthritis and Osteoporosis. We help people with joint pains and autoimmune disorders improve their joint and immune function and preserve them so that they can live happy and healthy lives. So you can find me if you're in the greater Seattle area at Overlake Arthritis and Osteoporosis, overlakearthritis.com. My LinkedIn is Dr. Arinola Dada. And now you can also find me on Facebook as Dr. Arinola Dada.
Wonderful, wonderful, wonderful. And like I already told you guys that she's one of the best. She's a 5-star doc. And I hope that when you're listening to this, you'll also give her a 5-star review because she is just that excellent, right? So for those of you guys who are watching and listening to this, yes, we have our first virtual summit. That's our Your Caring Doc is having our first. That's right. Our virtual summit is an Empowering Informed Women's Cancer Summit that will be held on October the 5th through the 28th. On the 28th, we're having a live portion of the summit where we have the wonderful Dr. Abina Brewster. She's an epidemiologist, medical oncologist here in Houston, Texas, with one of the top cancer centers in the United States. You do not want to miss that. We have some wonderful guests. We have speakers coming in. Dr. Minako Abe from Tokyo, Japan. We have Dr. Mitra Ayazafar, who is coming in from California, giving us the survivor story, right? When the doctor becomes the patient. And then we have the wonderful Dr. Lorna Rodriguez, my Boricua sister, who is the MD PhD extraordinaire gynecology oncology surgeon from California, where she's going to be talking to us about, she's going to be talking to us about ovarian cancer and why it's so hard. And then we're going to have some special guests who are there, so you do not want to miss it. So
I'm going to be there. I'm going to be there. It's going to be amazing.
You do not want to miss it.
It's going to be amazing.
That's our virtual summit. So we're looking forward to having you there. You can register at www.urcaringdocs.com. That's www.yourcaringdocs.com. Thank you all for spending the time with us, with Dr. Arinola Dada, my super doc from the Seattle, Washington area, with her Center of Excellence in Rheumatology. You guys do not want to miss out on her. She is so lovely. She has a great passion. And if you cannot feel it through this broadcast, I don't know what else, right? So we will see you guys another time. Thank you all for stopping by, and we love you for listening. Take care.
Thank you so much. Thank you, Dr. Beckford.
My pleasure. All right, bye-bye.